Increase the number of tests conducted by the lab has also, because of the response, definitely we need to continue doing the more tests, identify most positive, and look at isolating them. Obviously, the non-adherence to the protocol is a major challenge. I'm sure when we've not done assessment, but we're going to start one this week. Ever since people started seeing the surge, I can see the mask wearing is improving. And increased number of positive travelers is also creating a problem as part of that. The non-adherence of safety protocols during parties and all other unauthorized places where people are not supposed to be is also part of the problem that we are facing. Obviously, people are also walking in to have a test, and there's unlinked to anything, so it takes a few days longer before they're identified and isolated. That's also creating part of the challenge that we're facing. So far, when it comes to the schools, we've only recorded, for the 1 week that the school has reopened, only 3 cases in the Upper West, 2 schools in Upper West, where a school that had to, I think there was a case that brought him from Burkina and infected, but these are all under control. We also have 1 case in Western region in Aboagye. Otherwise, no region has reported any outbreak so far in the schools that has reopened. And that's quite, we hope it continues like that. Currently, we've strengthened contact tracing in Greater Accra. We are providing additional logistics, further number of contact tracers have been traced so that we can actually mop up the surge that is coming up. We've placed data and surveillance officers at the private labs so that anybody who tests positive is immediately linked to care. We've intensified risk communication. Our team and Greater Accra team will meet in the GPRTU, Market Queens, etc., to be able to talk to them to ramp up the use of the protocols, adherence to the protocols. We also, as part of increasing our accessibility to test, we are reviewing our policy to allow the use of, now we have 2 antigen tests that have been certified and registered by FDA. We are going to use them to look at when there's an outbreak, we can quickly do a test. In hospitals where there's a case of exposure by health workers, we can use them. We can use them in schools and other places. And those who are test positive, we may confirm with PCR. We are very confident because even the antigen tests at the airport, anytime we did a comparison with PCR, they are almost apart. And so we are very confident that the antigen tests will be very helpful in making us respond faster and also be able to reach out more people in a very short time.